A paper register is used to monitor and track the screening outcomes and attendance of YCC members. It is the responsibility of the YCC counsellor to keep the register updated. However, it is best that the YCC clinician help to fill out the YCC members' clinical information, such as CD4 or viral load outcomes, antiretroviral treatment start date, and ART regimen. After the YCC visit, a summary of the YCC visits should be recorded in the YCC members' clinical file for capturing into tier.net. The register is divided into 3 main sections. Let's take a closer look. Here you can see how to complete section 1. Put the YCC member's name, date of birth, gender, and file number in the first column. Next, write the patient's phone number and note whether it is their own private phone or shared with someone else. Write the YCC member's contraceptive method, the date and the results of their last CD4 count, and their last viral load. In the last column, write the YCC member's current ART regimen and their ART start date. This is section 2. Each column of section 2 of the register represents 1 month. That means a column for every YCC visit. If the member has been on ART for less than 6 months, write NI, newly initiated, in the top row. If the member has been on ART for more than 6 months and their most recent viral load is undetectable, then write VS, viral load suppressed. If the member's last viral load was detectable, then write NVS, viral load not yet suppressed. In the height row, record the member's height at their first YCC visits and every 3 months thereafter. In the weight row, record the patient's weight for each session. In the symptoms row, for each session, write one of the following: N for symptoms checked and normal, RTC for abnormal symptoms and patients referred to clinician. In the TB screening row, for each session, write either a plus sign for positive TB screening or a minus sign for negative TB screening. If the patient is not currently on contraception, ask if they are having or planning to have sex. If yes, write plus sign and refer to the club clinician. If the member is on a form of contraceptive, write minus sign indicating that they do not require contraceptive support. In the STI screening row, for each session, write plus sign for positive STI screening or minus sign for negative STI screening. In the nutrition screening row, write N for healthy and RTC for unhealthy and refer member to YCC clinician. In the PSS screening row, for each session, record the member's PSS rating from 1 to 10. Here is an example of a register that has been filled out. Each column of section 2 of the register represents 1 month, a column of every consecutive YCC visit. If after 12 months, YCC members chose to start meeting every 2 months, then the YCC counsellor will need to record YCC visits in every second column only, crossing out the second column. This will ensure that the annual blood visits indicated every 12 months or 12 columns remain appropriately marked in the register. Section 3 is completed when the club facilitator and data capturer sign and write their names and the dates at the bottom of the register. Register completion should happen within 5 weekdays after the club session. It's up to the club counsellor to take the register to the data capturer. Make sure that the data capturer has signed it, take it back, and use it for the next club session. The club counsellor must make sure that the register is signed and kept safe.